Dr. Brace here, it's Facial Plastics Friday, and we're going to continue on the topic of chins. Last week we talked about should you do a sliding genioplasty surgery or a chin implant, and today I want to flip it a bit and say what about a non-surgical chin augmentation with filler versus a chin implant? And I think both those options are fantastic, and it really depends again on the person. And so a chin implant I talked about last week, it's through a little incision underneath the chin here or through the mouth. I like going through the skin, and you slide a little Silastic rubber implant up onto the chin, and that gives you projection. It can give you a square jaw, it can give you any shape you really want. If you wanted a cleft chin, you can have that. If you want a little tiny button chin, you can have that. And you can use these Silastic rubber implants to redefine the angles of your anterior mandible. But if you're somebody who has trouble with general anesthetics, if you're somebody who just doesn't want to have a surgery, if you're somebody that doesn't want to have an implant in their face, there is the option of using a filler. And so the filler that I like to use is something like Sculpt, which is a high G prime filler. It's a very stiff, large molecule filler, and you don't need a lot of it to create a big change. And that gets injected right down onto the bone. And then depending on what we're starting with and what we're trying to achieve, you can fill all around this area like you would put an implant in and achieve a shape change of your chin with filler. That's done in the office. It's done over about a half an hour. It's an immediate result. There are very little risks. With filler, there's always a risk of getting the filler into a blood vessel and causing a circulation problem to the skin. But in this area, when you're deep and on the bone, that is a very infinitesimal small risk. So it's a very safe procedure. It's a very immediate procedure. There's no downtime, there's no sutures, and it's a great option for somebody that wants to try out what an implant might look like before they commit to doing a surgery, or someone that doesn't want to do surgery at all and wants to just stick with a non-surgical approach. And so implant versus filler depends on the person, depends on what their goals are. Both are great options. One of them is permanent with the implant. The other one is semi-permanent because the filler will last years, but not forever. It would need touch-ups. But either way, you're gonna get a better jawline, a more defined jawline, a different shaped jawline if that's what you're looking for. And so talk to your surgeon if you're thinking about doing those things, and they can guide you in the right direction. I am a biased surgeon, so I like putting implants in because it's a one-stop shop. It's done in one procedure. It's permanent. It can always be removed if you don't like it, but if you're a little bit gun shy, then filler's a good place to start. Everybody have a great weekend. Happy Facial Plastics Friday.